So you were asked a comparable question at last night's talk. But in your words, what does concierge medicine solve that ordinary primary structurally can't? And what does it risk getting wrong?
Yeah, so concierge medicine, or I will just say direct primary care, which to caveat what I'm about to say is that if you step back and look at what is health insurance? What is insurance? It's a financial instrument that you give money to somebody, and hopefully you never have to call them. But if something bad happens, you call them and they pay for an unforeseen large expense that you don't have the money for. Or maybe you do, but that's why you pay insurance. It's a hedge. It is a financial instrument hedge. And so fire insurance, you pay every year. I mean, we're in LA, but hopefully you never use it, but sometimes you do, right? Flood insurance, all these insurances. So health insurance is an interesting thing, right? Because health insurance used to be, and I say like 40 years ago, the same thing as car insurance or fire insurance. You only used it when something bad happened. But in 1973, something happened with Nixon when he created this kind of concept that laid the groundwork for HMOs, where now insurance companies were going to get in the business of primary care. So, what is primary care? Primary care is like the low cost. There's never going to be a big bill at a primary care doctor's
Mhm.
office, right? It's an office visit. It's $100. It's maybe an injection, which is $100. It's not going to be a 30,000 or $500,000 ICU hospital surgery complex care thing, right? So what happened is health insurance started to become a health plan. And as soon as they took over the plan, if you look at the nuances of what the medical industrial complex is,
Mhm.
they make money on complex, expensive things. Drugs, insurance, surgeries, laser beams, and so primary care, basically they said, look, we're going to start buying primary care and using primary care to funnel the sickest patients to the places that can make the most money. You know, I mean, obviously, insurance companies don't want to pay a lot of money, but the hospitals want that business. So effectively, what happens is primary care. It used to be a doctor would take care of 500 people back in the day, in the 70s. Then they started taking care of 1,000. Then they took care of 2,000. Then they took care of 3,000. And some of them take care of 5,000. So primary care in the current instantiation of the healthcare system, a single doctor is asked to take care of 3,500 to 5,000 people, right? And how can anybody manage that many people with any degree of consistency, quality? So what happens is quality falls down, and doctors have to now see 30 patients a day instead of 20, which means there's only so many minutes in the day. So if you only have 7 minutes per patient or 12 minutes per patient, you can't go through all the issues they have. You can only focus on a single issue that came up, and it's been very reactive. So it's a sick care system. You see the doctor when there's a problem. Maybe you have an annual exam if you're lucky for 30 minutes. So I say that as a foundation, but the primary concierge medicine is, hey, let's start honoring what medicine is. I'm a doctor. I spent 15 years in school. I want to help people. You're a patient. You're a person, sorry. You're a person that wants somebody to help guide you through and help you navigate and reason and make decisions about your health. So your health is something that you have, and healthcare is when you need to access somebody else. So concierge medicine or direct primary care, these are interchangeable terms, is
Mhm.
where you say, look, I'm going to pay out of my own pocket for a doctor that's not going to cost that much money, and hopefully have them have a low number of patients or members that they can truly take care of and know. I can know about your family. I can know about your goals. I can know about your stressors. In addition, so it's not just what's the matter with you, it's what matters to you. And how do you combine these things? And then I have the time after I've seen you and spent an hour with you to do some research, to talk to some specialists, to call you back, to share some things with you. So what happens, so what direct primary care or concierge medicine does is it reconstitutes this really important relationship between two people. And the existing system does not care. They care about money, they don't care about care. And I'm sorry, that's just, I'll say it out loud. It is just true.
Yeah.
Now, the doctors care about people, but this system doesn't care about the doctors, and they squeeze them so much down that they can't truly care. And which is why there's burnout and why doctors are leaving to join startups and but what's happening is the concierge market is growing like a weed. Maybe I shouldn't say weed. It's growing. It's growing. It's like literally it's the fastest growing segment in the healthcare system, primary care. Doctors leaving because they want their lives back.
Yeah.
You spend all this time in school and you want to feel like you're getting soul food, and the soul food for a doctor is helping people. But when your soul gets crushed by the system, you have no soul food, and it's no fun. So to answer your question very specifically, is concierge medicine, direct primary care solves many problems, but one, it increases the health of the population of people served. It improves the quality of life of the doctor, and it actually lowers the cost for the entire system because if I do my job right, you enter the healthcare system less. You're sick less, so you're using the system less. So the macro is concierge primary care and direct primary care is better for the whole system. But the system doesn't like it because they can't make money off it. And the healthcare system is really not a healthcare, it's a sick care system. The sicker you get, the more money they make. The system does not benefit from you being healthy. The system benefits from more transactions. So if you have a great doctor, you prevent transactions because, I like to say that markets are predictable and technology is kind of predictable. I mean, not predictable, but biology is really predictable. And if you really get to know somebody, you can track, compositive trends. You can see a medical problem happening years before it happens, and you get out in front of it and prevent it from happening. So it's prevention. That was a very long answer. Sorry.
No, that was a good answer. I appreciate the detail. Um, so relatedly, private medical emphasizes trust as foundational, and so what are the operational choices that create that trust at scale?
So a lot of it gets down to like
Mhm.
principles and ethics. So the first thing, there's something called a supply side moral hazard, which is a lot of systems that exist, and I'll get to concierge doctors and private doctors in a second, and private medical in a second, is if I do a test or I order a thing, I may have a little extra, I may make money off of that, right? The more things I do that benefit me, I may do them when I maybe don't need to do them. So we think about trust as like, we're always going to do the right thing at the right time for the right reason, and we're not going to profit from it. So we have no profit motive in prescribing a blood test, ordering a medication, sending you to a specialist, or anything. So ultimately, your good outcome is in our best interest because the more time you spend, the more time we spend, like we're on a fixed amount of money that we get every year. So if I spend lots of time ordering tests and doing things and I'm not making money from them, I'm on the same side of the ledger as you are. Like, so that's part one is we don't want to have any financial motive that's not in your best interest.
Mhm.
Number two is we so we have a culture that we really try to hire people, doctors, and train them in a way that, I mean, how do you hire anybody who's a good person? But we have a kind of a hiring methodology where we really try to hire people who genuinely care, are in this because they're natural healers. They went into medicine because it was a calling, because it was something that felt good to them as they were doing it. And we have a lot of and by the way, showing up and being there for people over time. I mean, that's what trust is, right? You show up and you do what you say you're going to do, and you show that your interests are aligned with someone else's interests. I mean, we have a 95% retention rate over 20 years. People don't generally leave. I mean, sometimes they do, but they move or be personality issues. But in general, um, trust is based on communication. and good communication. So we spend a lot of time thinking about communication architecture. And you can call me anytime, you can text me anytime, but you don't do that. You don't want to abuse that privilege, and we don't want to overwhelm you with communication either. So a lot of it is just calibrating and having the ability for the doctor and the patient to kind of over time work together to develop a cadence and a rhythm and a mutual respect for each other. I would say those are the main ways because trust is some very intangible.
Yeah. No, it's a tricky phenomenon. But I really appreciated
Yes.
your like communication architecture framework as you explained it in the talk. Um, So, prevention and early detection are central, as you have emphasized. And so, getting a little more into medical practice, which interventions have like the best signal to noise for healthy adults between like sleep, blood pressure control, lipids, etc. And what's currently more hype than help? If that's a tractable enough question.
Yeah, yeah, those are two questions. So the first part of the question is there's a lot of these like foundational things like sleep and exercise and diet. Like the one thing I did say last night is that like you and me, we need 30 grams of fiber a day. Everyone's talking about protein, so that's one of the hype things. Everyone's hyping protein. It's actually they should be talking about fiber. Fiber is way more important for your body than protein is. Unless you're going to the gym and trying to be Arnold Schwarzenegger working out, you don't need all that protein. You pee it out. Fiber is what feeds your gut. Your gut uses that food from the fiber to make short chain fatty acids, which are like natural GLP-1s, which means you are less hungry. It also is a precursor to tryptophan in the liver, which turns into serotonin. Serotonin is the happiness molecule. Dopamine is the pleasure molecule. And so if you don't have enough fiber, you're getting, your gut makes 90% of the serotonin in your body. So I think a lot of the anxiety and mental health issues are we suffer from a fiber deficiency. But so outside of these foundational things that I'm talking about now and blood pressure, like these are the low-hanging fruit that everybody should do, but it's just hard to do because there's seems like there's so many of these things to do. But those all are accretive to a good health span and a good lifespan, so we shouldn't ignore those. When you double click into understanding your risk. So one thing is like, yeah, high blood pressure leads to higher risk. Low fiber leads to higher risk. So ultimately, this is just like a kind of a risk assessment of like, what is your risk of everything? And so so then you get into the sophisticated genetic tests, these sophisticated AI-based cardiac screening tests. There's all these things where you can do tests to understand your risk. And once you understand your risk, you can build strategy. And so, like, there's the foundational stuff, then there's like a layer deeper, which is like more sophisticated. Then there's like the crazy sophisticated stuff. And then once you've done the risk assessment, then there's interventions, and some of them is just basic stuff. Some of this you need to take a medicine. Some of them is you need, to do something else. You need to get an injection or something or an infusion of something. These are therapies that will bend the curve so that you don't go down the hill too fast. So there's like so many that we could go into on that category, but suffice it to say that, on the prevention proactive side, there's just a lot of things to do. And that's why when I ask people, do you have a strategy for your future self? People say, of course I do. I'm like, well, what is it? And they say, well, I eat and I do this. And I'm like, that's just a bag of tactics. That is not a comprehensive strategy. And then they acknowledge that, I mean, most people are experts in what they're experts in, and I'm an expert in medicine, so I know how to build a strategy for somebody, but it requires knowing a lot of data to build that strategy. And so there's a lot of signal to noise in those things that I just described.
Mhm.
But on the other side, on the hype side, you know, any there's so much hype. I mean, like IVs, just for one. I mean, there's 58,200 nanoplastic particles that go directly into your bloodstream because those IV bags were made in China. Soft plastics leach, leach nano and microplastics out of those bags. So if everyone getting a wellness IV is actually harming themselves by putting tens of thousands of microplastic particles in their directly into their bloodstream. It's one thing if you drink water in a plastic thing, your gut is a barrier to remove some of those microplastics. All these peptides, most of them unproven. Sauna, cold plunge, steam bath, like no harm, no foul, like probably helpful. Data's starting to bear out that there's some benefits in the concept of hormesis is when you stress your body, it develops more resilience.
Sorry, what's that term?
Hormesis,
Or mis-
Hormesis. And that's a field that's starting to get more and more studied. Well, that's the intermittent fasting too. You starve yourself a little bit, you stress your body. It doesn't generate as much oxidative stress in the body. I mean, obviously, the more you eat, the more oxygen-free the more oxygen sugars you have to process, which creates ATP and oxygen. And that oxygen, for every 10 things of sugar you eat, like you may get one. I'm just making these numbers up. One oxygen-free radical that can go around and damage DNA and RNA and mutations and stuff like that. So the peptide craze I think is bananas that people are injecting themselves with things that they don't even know where they're from. And then there's this whole article about Chinese peptides. And as I said yesterday, there was one of my patients wanted to do some peptides, and we found there was MDMA, herbicides, and all sorts of like unknown, toxic compounds in the thing that, so people are like the citizen science, the podcasting celebrities, all these people are doing stuff, and it's almost like a meme. It's not science. Um, what else is a lot of hype?
Yeah, is there like some specific biomarker in longevity culture that's like really misused, misunderstood, or just
Yes.
ineffective?
So I like to say that more is not better.
Hmm.
And I wouldn't say that less was better. I would say that better is better, right? And what do I mean by that? Biomarkers, getting a bunch of, longevity is not a biomarker deficiency syndrome,
Yeah.
right? Meaning, and getting your, blood checked every quarter or every week or every month, you know, the human body, like things don't just show up out of the blue like that frequently. So, I mean, I think we do blood tests every year on people, but, every year, is that the right answer? I don't know. I mean, every year just represents the time that this rock that we're standing on went around that ball of gas that's up in the sky one time. And so does a single, I mean, this is a cosmic number that like is super random, 365 days. So maybe in the process of learning more about people, we may calibrate. You should get your blood test a little more frequently or a little less frequently based on your risk. So everybody getting all these and by the way, there's a lot of biomarkers that there's no science for. It just they're making it up or they're learning as they go. And so, there's a lot of people that have symptoms or problems and there is no answer. We don't know why they have it. Probably some viral, post-viral syndrome or whatever it is. But because humans have a hard time with uncertainty, they must know. People will go seek out every blood test that isn't validated because someone's going to say, I've got a blood test that will answer your question. So if you have some syndrome or problem, there's a lot of people that will sell you blood tests that like will give you an answer, but it's probably not the right answer. This just goes back to what I'm saying. Did you get the right answer to the wrong question? Um, and then there's people that just want to like, remember the quantified self, just get every biomarker under the sun and do more and more things. Well, guess what? The more and more things that you do that are truly unproven, untested, and the data doesn't exist, well, you're just spending more time in your life doing biomarkers, talking to doctors, doing research. And the question is that really what you want to be doing with your life? Like, don't you have something else that you're trying to accomplish in your life? And so I think that, I'm trying to provide a beacon or an exemplar of like, there's a right way to do this. And then there's like a wackadoodle way to do this. And the right way to do this is to have an honest conversation, look at the science, do the diligence. I mean, look, I'm as skeptical about things as the next guy or girl. So I don't just believe a study because it came out. I want to go tear it down, break it apart, look at it in detail and try to find the weaknesses so that I can have an honest conversation with somebody about like, hey, this study says this. It may not apply to you, and maybe we should try it, whatever the intervention or the thing is. But let's monitor the results of this thing, and if it doesn't work, let's stop. So there is a kind of a responsible citizen science way, but right now everyone's just doing everything because it's woohoo. It's the I say when YOLO and FOMO have a baby, you get a peptide circus, or you get a longevity circus. So that's kind of, people are just, they want to be liked on Instagram and they want to post things and they want to show the world how smart and great they are. And they don't really care about the science. I was talking to a guy today who started an IV company and he was telling me how proud he was that they have 55 clinics and, he's making lots of money. I said, did you know that IVs like poison people? He's like, well, we make money. And I said, well, you know that there are IV bags that you can use that don't leach plastics out. They're made in Europe, not China. He goes, yeah, but they're much more expensive and that eats into our margins. So, like, I mean, this is capitalism. I don't care. That's why I wrote that Hippocratic oath, which is I think companies should take the same oath that doctors do. Do no harm and make money doing it. But don't do harm and make money. That seems to be kind of antithetical to the healthcare system, or at least it's objective.
Yeah, I mean, one would hope so.
Yeah.
So on that subject of uncertainty, how do you communicate uncertainty, false positives, conflicting guidelines to high anxiety patients?
This goes back to communication architecture. It's like
Mhm.
really trying to understand what grounding their anxiety. What are you afraid of? What are your goals? And and then looking at the data and saying, look, we're living in, statistical uncertainty and, probabilistic universes, and we have to do it based on your value system. And some people want to be really aggressive, some people want to be really conservative. But with proper oversight, you can do either or and see if it works or not. Or understand, I mean, somebody wanted to do the cancer test, the Gallery cancer test, and or they want to do Pernuvos every quarter or these full body scans. I'm like, look, there's something called pre-test probability. So if you have a low pre-test probability for finding something on a test, and the false positive rate is higher than your pretest probability, then like don't do the test.
Yeah,
And by the way, every time you do a test with a false positive rate, the more you do it, you amplify the false positive potential.
yeah.
So the people that do more things are at risk of getting more false positives. And then, like I said, you go on these medical safaris, and then you're going to spend your life like in the medical world. I'm like, dude, you've got a life to live. Go be an engineer, go be a golfer or an athlete, but stop spending all your time trying to be like an expert. And the way I say it is like, there's a restaurant. What's a famous restaurant that you know? Pick a famous
Uh,
restaurant.
no, mom.
Noma. Okay. So, and Noma makes this amazing dish, whatever it is. They're miso glazed cod, making it up, right? You can say, I'm so smart. I'm an expert. I'm not gonna go to Noma and pay $60 for the miso. I'm gonna make it myself, right? I'm gonna go to the recipe. I'm gonna go to the menu. Well, guess what? You have no experience. Knowledge is transferred over time through trial and error. It's not a binary thing. And you don't know the exact time to do this, the exact pots and pans you need, the oil, all the ingredients that they use at Noma are like it's done in this like orchestrated way, and there's tacit knowledge and wisdom in that meal. So go to Noma and pay the $60 for your miso glazed cod. Don't be the guy that's going to spend all this time. And by the way, it took you an hour and a half to get the best meal. You had fun with friends. If you try to make it yourself because you're trying to save money or show you're an expert, it's never going to be as good. It's going to take you a ton of time, and then go become a chef then. But don't be a computer engineer that's going to like. Now, I'm not saying don't try to learn how to cook. Of course, you should learn how to cook. But I think a lot of people are conflating knowledge with data.
Yeah.
And I don't know if you were there when I said it, but if you take a bunch of AI, and if you take a bunch of books on how to build AI, if you take a bunch of computers that have ChatGPT and know how to build a bridge, and you take a bunch of computers and a bunch of cement and throw it in a ditch, you're not going to get a bridge. Like AI and cement aren't going to figure out how to build a bridge, even though it has all the instructions on how to do it. There's all this knowledge that has to get transferred. And that was where I was saying, there's a great podcast on machine learning street talk by Cesar Hidalgo. If you haven't listened to it, you should, Damian, which is how knowledge gets transferred. So I just think there's all these smart people that have access to the internet and ChatGPT and all these things, and they think they can just figure it out on their own. And what I see is that it's risky. And it's a waste of your time. That's not what you're here for. I mean, why don't you go do the thing you're great at or
Yeah.
that you love to do?
Sound advice. So I'm curious about Health Loop. What was like, was there some workflow change that really reliably improved outcomes as you arranged that complex system? And in particular, was there some AI or automation promise that didn't pan out?
No, everything panned out actually. It was like we changed workflows. People loved it. Doctors loved it because they had less. I mean, there's a much more complex answer to that, but doctors loved it because they could know how all their patients were doing at any time. The staff loved it because they were communicating. This was when their fax machines were still in full effect, and this was in 10 years ago when all of a sudden you could use this tool instead of email. Email is sloppy and messy. It's a shitty communications. I mean, it's good, but it's not coherent, really. I mean, obviously with AI now it's getting better. Patients loved it because they felt they were connected with their doctor around a specific problem. The reason that it was problematic is because we were getting better outcomes and lowering costs. Everybody loves that, right? No, they don't. The system makes more money. So we proved that we could reduce hospital readmissions for a surgery by 50%,
Well,
relatively speaking. But guess what? Hospitals get paid twice as much for a readmission because that's a sicker person that came in the first time. So they don't want to not have readmissions. That's where they make their money. So the incentives and the goals of the system are, and this is where Donella Meadows, if she wrote an essay called Leverage Points, places to intervene in a complex system. And the healthcare system is just this incentives are all not just the incentives, the goals, the governance, the paradigm. It's all wrong. The sicker you get, the more money you make. That's the system. That's the paradigm. I think the paradigm should be for the healthcare system is to improve the health of our citizenry so we can have a productive workforce and a productive society that's not sick all the time. By the way, I have 3 minutes left.
okay, I think I'll end with this then. So, concierge
Okay.
care draws criticism as a two-tiered system. What is your best reconstruction, steelman of that critique, and what is your best counter-argument?
So I guess my best counter argument is what is healthcare, right? So it's a service provided to people, and but so is so if you look at the main structural components of what a government should do for people, right? Or there should the transportation, food, shelter, healthcare, education. Okay, so let's break all those down. Education. There's public schools. Anybody can go to public school. There's private schools. Education has a two-tiered system. Okay, check. Transportation. There's public transportation. You take the bus. If you want, you can buy a Range Rover. So transportation, two-tiered system, right? Housing, Section 8 housing. If you don't have a lot of money, there's something for everybody in housing. But if you want to buy something in Beverly Hills, you can power up. Two-tiered system. Food. You're on SNAP, food stamps. Everybody has the access to some food. But if you want to go to Noma, you can power up. Two-tiered system. Why is healthcare different than everything else? If you don't have food, you will die in 3 days, food and water. So, and if you don't have education, then you have a really bad. So I just think, why is healthcare an island of socialism in a sea of capitalism? Why? And so listen, I'm all for there being a base case that everybody should have access to good, decent healthcare wherever they are. But if you want to power up and if you want to use the money that you made in the capitalist society you have, like, why is this different? And if people are much more satisfied with this method, because then why would we criticize better outcomes, happier people? And by the way, these people are paying out of their pocket. It does not cost society. And like I said earlier, people are having less utility of the healthcare system, which means that the people who really need it now can get it because the concierge market is actually removing people from the system because we're keeping them healthier. So I fundamentally think that you know it's a strange critique to me, especially living in the United States, and I'm as capitalist as the next guy, but I want everybody to have good health care, which is why I think AI can really democratize this. And by the way, to use Tesla as a metaphor, they started off with that little Lotus looking car, the little, I forget what it was called. And it cost $120,000. But Elon wanted to ultimately democratize that and build the Model 3. But he had to spend the money in the R&D on the expensive things. That's where innovation happens. And so to me, private medical and what I'm doing is I started this whole field. It's expensive, but I have now shared the blueprints with all these other people. So now you can get what I'm doing at a much lower price, and it is being democratized. I think AI will democratize it even further. So I think it's a specious argument that like why do we have a two-tiered system where everything else is two-tiered, three-tiered, four-tiered? Like I think everything should be tiered because that's where you learn. And if I'm learning, if I'm designing and building things at the expense of other people and not society, tell me why that's a problem.